Have you ever stopped to think about the invisible forces that are protecting you every single day? And no, I'm not talking about something out of a comic book. I'm talking about a system, an idea really, that has completely reinvented human life as we know it. Today, we're going to pull back the curtain on the incredible, often unseen story of public health.
Okay, let's just dive right in with a big question. What single thing, what one idea, has added more than 30 years to the average person's life in the last century alone? I mean, think about that. Is it some miracle drug, a revolutionary surgery? Well, the answer is actually so much bigger, and it's all around us.
And that answer is public health. See, it's not about treating you or me when we're already sick. It's about creating the conditions where entire communities, entire societies can be healthy in the first place. It's the science and art of protecting all of us together. It's an invisible shield we've been building for more than 100 years.
So, how did we actually build this shield? Well, that's the journey we're going on. We'll start with the gritty battle against filth and disease, then see how science let us target specific germs. After that, we'll explore the big shift to our own lifestyles, uncover health's surprisingly deep social roots, and finally, take a look at what the future holds.
All right, let's rewind the clock. We're heading back to the 19th century. It was a time of amazing industrial progress, for sure, but it was also a time when our very own cities were becoming death traps. This was the first great battleground for public health.
So, the Industrial Revolution was packing people into cities faster than anyone could handle. But here's the problem. There were no real sanitation systems. Just imagine these overcrowded neighborhoods where the water you drank was literally contaminated with raw sewage. It's no wonder that diseases like cholera and tuberculosis weren't just common, they were an absolute plague shaping daily life and, well, daily death.
In the middle of all this chaos, the common belief was that disease spread through bad air or miasma. I mean, it kind of makes sense, right? Things smelled awful, but it was completely wrong. And proving it wrong didn't start in some fancy lab with a microscope. It started on the streets of London with a simple map.
This, right here, is where everything changes. A doctor named John Snow did something that was, at the time, revolutionary. He just marked every single cholera death on a map of a London neighborhood, and what he saw was a terrifying pattern. The deaths were all clustered around one specific water pump on Broad Street. He realized the killer wasn't in the air, it was in the water. To prove it, he convinced the authorities to do something drastic: remove the pump handle. And just like that, the outbreak stopped. This single, brilliant act gave birth to modern epidemiology, what we now call disease detective work, and it kicked off the massive sanitation projects that would go on to save millions of lives.
So John Snow showed us where the threat was hiding. But the next great leap forward would show us exactly what that threat was. Science was about to give us the power to see our invisible enemies for the very first time.
And this was a total game changer. You had Louis Pasteur's germ theory proving that tiny little microorganisms were the real culprits. Then Robert Koch came along and gave scientists a playbook for linking a specific germ to a specific disease. All of a sudden, we had clear targets. This unlocked incredible new tools: pasteurization to make our food safe, quarantines, and of course, the big one, vaccines. And the ultimate triumph of this whole era? In 1980, smallpox was declared completely eradicated from the planet, a disease that had tormented humanity for centuries. Just gone, all thanks to a coordinated public health effort.
So what this really boils down to is a massive shift in strategy. We went from these huge general environmental fixes, like building citywide sewer systems, to incredibly specific scientific strikes. We weren't just fighting the environment anymore. We were fighting individual, identifiable microbes with, you could say, precision weapons.
But here's the twist. As we got incredibly good at fighting off infectious diseases, a whole new kind of threat started to creep in. The very success of public health meant people were living longer, long enough to face diseases that weren't caused by a germ, but by how we were actually living our lives.
And this chart just shows it so clearly. If you look at the early 20th century, the top killers were things like pneumonia and tuberculosis, infectious diseases. But by the end of the century, the chart is completely flipped. It's dominated by chronic diseases, heart disease, cancer, diabetes. Public health had to evolve yet again. The enemy wasn't just a microbe out there anymore, it was also found in our daily habits like smoking, our diet, and how much we moved.
So the new strategy, which was laid out in this really important document called the Ottawa Charter, wasn't just about nagging people to live healthier. The real insight was about reshaping our communities to make the healthy choice the easy choice.
That means things like huge public campaigns against smoking, promoting exercise, and basically building environments that naturally support good health.
But you know what? Even that wasn't the whole picture. As we kept digging, we realized something profound. Our health isn't just shaped by germs or our personal choices. It's fundamentally shaped by the conditions we're born into, and where we grow, live, and work.
These are what we call the social determinants of health, and they are the true foundations. I mean, just think about it for a second. How can you prioritize eating healthy if you can't afford fresh food? How can you manage a chronic illness if you don't have access to good health care? Things like your income, your education, the safety of your neighborhood, they have a massive, direct impact on how healthy you are.
And this brings us to one of the most powerful lessons in this entire story. For public health to really, truly work, it has to work for everybody. Equity isn't just some nice-to-have moral goal. It's a practical necessity. A society's health is only as strong as the health of its most vulnerable people. That invisible shield has to cover us all, or it's full of holes. So that brings us to today, because the story of public health is nowhere near finished. The challenges we're facing now are more complex than ever before, but thankfully, so are the tools we have to fight back.
I mean, we are now facing these enormous global threats like climate change, the insane speed of misinformation, and the really scary rise of antimicrobial resistance. But at the same time, we have these incredible opportunities, from using AI to predict disease outbreaks before they start, to new levels of global teamwork, and a growing understanding that we have to integrate mental health into this whole picture.
So after this whole journey, it really kind of boils down to this number, 5. 5 fundamental truths that public health has taught us over a century of trial and error. 1. Our environment is the foundation of our health. It always was, always will be. 2. Science is our flashlight. It lets us see the invisible threats and gives us the tools to fight them. 3. A shield that doesn't protect everyone protects no one. Equity is survival. 4. An ounce of prevention is worth a pound of cure. It's always the smartest investment. And 5. The challenges are always changing, so our greatest strength has to be our ability to adapt for the threats we haven't even seen yet.
From fighting cholera and dirty water to tackling these massive global challenges, the core idea of public health has not changed. It's about protecting each other through organized, collective effort. It's the invisible shield that gave us decades of extra life. So the real question for all of us now is, how are we going to reinforce and expand that shield for the generations to come?